So we are from Group 2, and today we are going to present our multivariate analysis project. Our group member got Chasuchi, Clement, Dania, Dorothy, and also Annie. So for the introduction, the Kaggle dataset is entitled Healthcare Diabetes and is related to healthcare industry where the main focus is on detection and management of diabetes. This dataset includes a wide variety of healthcare-related characteristics that have been carefully gathered to support the development of predictive model for identifying people who are at risk of developing diabetes. So in this project, our group is going to use the data analytic, which is factor analysis, to perform. The main goal of the analysis of healthcare diabetes dataset is to develop a clear understanding of the factors causing diabetes and using this knowledge to create predictive model for early detection. For example, the dataset enables the industry to build a predictive model to classify whether a patient has diabetes or not, and also classify the patient into low, medium, and high risk group for focused intervention based on the health indicator. So besides that, the further analysis supports efforts to avoid the diabetes by offering important insights into which health metrics have the biggest impact on the disease. So next, data description. This dataset got 9 variables and also 1 column of outcome. The 9 variables are ID, pregnancy, glucose, blood pressure, skin thickness, insulin, BMI, diabetes pedigree function, and also age. So the first variable ID is a unique identifier for each data entry. The second, pregnancy, is the number of time pregnant which is relevant to female, as pregnancy can influence diabetes risk. Next is the plasma glucose concentration, also used in the prediction of diabetes, as high glucose level can lead to diabetes. Next is the blood pressure, indicate diastolic blood pressure. The skin thickness indicate tricep skin fold thickness, and the insulin, which emphasizes the psychological state of patient as a whole. Next is the BMI. BMI is a measure of body fat and diabetes pedigree function, which rates the risk of diabetes based on genetic variable and family history, also used by the industry to predict diabetic patient. So since the diabetes is more common in elderly people, age also count into the consideration. So the outcome column use the F1 score to evaluate the model fairly, where 1 means the model predict perfectly in identify diabetic patients, which is diabetic presence, and 0 means the model failed to identify diabetic patient, which means diabetic absence. So next, I will pass to my member.
Now I will be talking about methodologies. So our group is going to use factor analysis for our data. So what is FA? FA is a statistical technique used to uncover underlying factors that explain the relationships among observed variables. It will help to simplify large data sets into smaller number of factors, making the data easier to interpret. Before the technique is able to perform, we need to make sure there is a stronger correlation among variables in order to measure the crucial foundations for meaningful factor extractions. The reasons for choosing factor analysis is that we are concerned about how is the observed variables can be classified into a groups and their factor loadings. We will be discuss about its procedures of FAs in the next sessions.
Before we start factor analysis, it's important to prepare the data properly. First, ensure the data set has no missing values. Then, remove any irrelevant variables that don't add meaning to the analysis. Since we use correlation metrics to apply the factor analysis, so there is no need to standardize the data. Next, correlation matrix is computed to assess the relationships between variables. At the same time, script plot is generated to determine the number of factors to retain. Besides, initial factors extraction give us annotated loadings showing the relationship between variables and factors. To simplify and clarify the structure, we apply varimax rotation, which will make the factor loadings more distinct. Then we evaluate commonalities that tell us how much variance in each variable is explained by the factors. With these steps, factor analysis becomes a powerful tool for uncovering hidden patterns and relationships in data.
Today, I will briefly present the findings of factor analysis on healthcare sector. The research found 2 latent factors, Factor 1, ML1 is predominantly driven by genetic and demographic factors with high loadings from diabetes pedigree function 0.9, age 0.9, and pregnancy 0.6. This shows that ML1 captures the genetic and demographic hazards linked with diseases such as diabetes. Factor 2, ML2, is linked to metabolic and physiological features, as evidenced by high loadings from skin thickness 0.7, insulin 0.6, and BMI 0.5. This factor most likely explain health indicators related to body composition and metabolic function. The contrast between these two components demonstrate that risk factors are organized around two major areas, which is genetics and metabolism. This information can aid in targeted health therapies and address both inherited predisposition and lifestyle factors.
For conclusion, the analysis of the healthcare diabetes dataset using factor analysis revealed two key factors affecting diabetes risk. Firstly, metabolic and physiological measures strongly linked to skin thickness, insulin level, and BMI, which are critical indicators of metabolic health and fat distribution. Secondly, demographic and genetic risk factors connected to age and pregnancy history, highlighting hereditary and life stage influences. This insight can drive targeted interventions such as personalized dietary and exercise programs for at-risk groups and guide predictive modeling to identify high-risk patients for early care. By focusing on crucial metrics like BMI and glucose, healthcare systems can optimize resource allocation while advancing research on diabetes and related complications. This data-driven strategy promises better prevention, diagnosis, and enhanced patient outcome.